Let's see, where are you guys? Hey, Leona. You have to unmute yourself. Click.
Okay, does it work?
Yeah, it works.
Is it working now?
Yeah, hey, Leona. Hey, Sandy. Hey, Ken.
Hey, Nelson.
First off, thank you for joining us today. I know it's been pretty busy for you guys, so I appreciate you guys taking time out of your day to come visit our class.
And the reason why, we have the data, so what's the follow-up? What are we going to ask?
Oh, sorry.
That's okay.
He's at work.
Are you at
Okay.
work right now, Ken?
Yeah, I'm at work. It's fine.
Okay, hopefully.
Go ahead.
All right, so basic how it's worked, the students, they prepared some questions in advance, and I'm just gonna read them off to you guys. I'll tell you guys the name of the students that read it. If they have any more questions for you afterwards, they can unmute their mics, but really the job is, I was actually trying to, Leo knows, I was trying to schedule some time with someone from other nursing friends to come speak to our class during the school year, but the schedule was kind of tough because I know you guys are really busy and we have a small time frame. So this is actually perfect for what we needed to do. So we have a list of questions we're gonna ask you, but before we get started, I know that kids are super interested in this, and this is probably the elephant in the room. They kind of want to know about what's happening in the medical field regarding like the coronavirus and stuff before we get into the profession, because I know they're kind of curious and have a lot of questions about that.
All right. So I guess I'll start off. I'm Leona. I've been a labor and delivery nurse for about a little over 2.5 years. With the coronavirus at my hospital, since I work in a department where there's always like mommies and babies, we're just doing extra screening, especially with visitors now, to make sure no one has symptoms. We're actually limiting visitors now in our unit. So it's kind of sad because when you're delivering your first baby, you want like your entire family there, but now we're kind of strict on that.
Okay. Before that's actually a good starting point. I forgot. So now that we have all 5 of our nurses here, if you could take turns, just introduce yourself and explain. I guess for our students, we realized there were nurses, but you guys have different fields. So maybe describe your field. So introduce yourself and your type of nursing.
Okay, I'll go next. Hi, my name is Alan. I've been a nurse for about 2 years. I work on the medical, surgical, and telemetry department, which is basically I get a lot of post-op patients who are pretty much stable, who are downgraded from ICU or come from the ER and then just waiting to be discharged home once they're 100% clear. But as far as the coronavirus that's going on, it's pretty scary, especially for me, because I am pretty much exposed to coronavirus. We do get patients who are PUIs or persons under investigation. So anyone that comes in with a sore throat, a cough, or even just a fever, they're usually heavily screened, and then they're placed in isolation, and we have to gown up, the whole PPE, wearing goggles, the whole mask and everything. And that's pretty much with everyone that's in the hospital that comes with a fever or a cough or shortness of breath. And it's a pretty scary time, but we're all working through it together, and this is a field that's very rewarding. You go home feeling really glad that you really made a change in someone's life. So it's great.
Thank you, Alan.
Let's go with Sandy.
Hi everyone, my name is Sandy. I am actually a 4th semester nursing student at Glendale Community College. And in terms of my interests, I currently work at County Hospital, LACUSC, right now not in the emergency department because they're not allowing students in the emergency department, but my interest lies in ICU and emergency. So in terms of coronavirus and how it's affecting us as students, it's actually been a pretty big struggle because we're unable to complete our clinical hours due to coronavirus, since they're not accepting students to finish our clinical hours. But of course, we're staying up to date with the Board of Registered Nurses, BRN, and they're trying to expedite student nurses, especially fourth semester student nurses, to be able to finish their clinicals in the hospitals, especially for those who do hold a position as a healthcare worker. So that's what I'm dealing with right now as a student.
Okay, Ken? Can you have to unmute yourself?
Hey there. Oh, sorry. Hi there. My name is Ken. I'm a registered nurse. I've been a nurse for about 6 years. I used to work for the county, LCUSC. I was an emergency nurse for about 4.5 years. Now I'm working at Kaiser Sunset. Here I'm a case manager here. We're getting hit pretty hard with a lot of coronavirus patient COVID. We have over maybe 60 cases here. So we have a couple of units dedicated to COVID patient, but we've been on top of everything. Like Leona mentioned, like probably all the hospital mentioned too, like no visitors coming into the hospital. It's pretty sad because they're here all by themselves. So the only point of contact is us as the nurses. We have to talk to them, give them comfort, and then point of contact with the family also. We have to coordinate the discharge planning because I have to discharge some of these patients home who are positive for COVID, with mild symptoms that medically stable that need to coordinate that because sometimes they can go home to their family or they have sick people at home too. So I've been helping coordinating all that, which is my big role right now at Kaiser Sunset.
Okay, and Melanie?
Hey guys, my name is Melanie. I currently work at White Memorial in East LA. I work on the medical surgical ortho floor, so we basically take care of, what Alan said, all the downgrades from ICU, any downgrades from telemetry, any ER patients. But my specialty is mainly in ortho patients or post-op patients, but we also get those too as long as we have room for them. For coronavirus right now, the whole hospital, we're not letting any visitors, just like most other hospitals. It's only mostly staff. And there's only 3 main entrances that we're allowed to enter through, and at every entrance they screen us. So they basically ask us, if we have any shortness of breath, any fever, sore throat, or like any cough. And depending on how you answer those, you either pass, they let you in, or if you answer like any, I guess yes to any of those, they'll like let you take another survey, I guess asking if you've ever traveled or anything. Right now, we also have designated floors as well. The telemetry floors are the designated floors that we've been sending all of our PUIs, person under investigation, or positive COVID patients. And then some of ICU, depending if they need the higher level of care, depending on their acuity, they also have some as well. And we also recently opened up an overflow unit because our telemetry unit's actually full. There's there are a few there's a lot of PUIs and a few positives. But our 3rd floor is also opened up now to take in more patients that are either positive or PUIs as well.
Thank you. Okay, so we have a list of questions, and there are 5 of you, so feel free, any of you to answer the questions, just because it's general questions about your profession, but thank you for letting us know about the updates. I know everyone in the world is kind of curious about what's happening. So currently you're talking to my senior class. This is the AVID program, so it's a college prep program. The first thing they want to know, and they are in the middle of deciding which colleges they want to go to and a few months away from actually going to college. So the first thing they want to know is, how did you know you wanted to be a nurse? What made you choose that profession? And this could go to any person.
Well, growing up in a super Asian household, my parents really wanted me to be like a doctor. So growing up, I had that mindset of I have to be in a medical field. But during high school, I definitely didn't want to be a nurse. I actually wanted to be like a flight attendant and travel the world. Until I entered college, I actually went to community college first, and I started taking my general eds and started taking the science courses, and that's when I realized hey, anatomy is actually a pretty cool class, and I looked into nursing again, and that's when I decided nursing was the thing for me.
I guess for me, first in college, I was initially a pre-med major, from pre-med to pharmacy and into pre-PA. And then when I graduated with a bio degree, I didn't know what I wanted to do at that point. So I ended up going to a hospital in West Covina, and I volunteered there. I think in the past it was called a CCE, Clinical Care Extender. So I volunteered at the hospital for about a year and a half, and I actually did get to do a lot of hands-on things, and I worked under the preceptorship of registered nurses. So from that point on, I was able to really find out what I wanted to do. And at that point, that's when I started applying to schools, and then I kept volunteering, and then that's when I wanted to be a nurse.
Cool. Anyone else?
Yes, I'll go next. So this is probably like the sappiest story probably, but my grandma, she had ovarian cancer, and we found out late. So like for most of her last year of her life, she was in and out of the hospital a lot. And you know, my mom and my sister and I, like, we went to, you know, we were there a lot with her. Like, we spent a lot of the nights there just visiting her, even though sometimes maybe it's not overnight. But basically, I just saw how the nurses, like, you know, treated her, how they were, you know, very loving, very caring towards her, and very considerate of us, you know, like for, you know, be that for someone and their family. And that's basically why I wanted to become a nurse.
And for me, I actually, straight out of high school, I took the very traditional route. I went to a four-year University of California, and I majored in a degree, or I got my degree in a field that's completely unrelated to medicine and nursing. But the reason why I decided to go into nursing was similar to Melanie's. The reason, I actually had a family member who was ill, and through that, taking care of her, I always knew that there were some qualities in myself that I feel like I should be in medicine or nursing. And I think just being able to be surrounded with her and her physician and her nurses, it kind of just detoured my career path. So that's the reason why I went into nursing.
And then for me, similar story like everybody else. I went high school, then I went community college, but I went to private school afterwards. And then I ended up, during while I was in private school for nursing school at West Coast, my friend got really ill. He was in the ICU. So then from there, I was watching the ICU nurse taking care of my friend, and I felt kind of helpless. So that encouraged me to become a nurse. And then yeah, that's pretty much it.
Okay, thank you for sharing that. So, as I said before, a lot of them are high school seniors entering the fall. I know about 3 or 4 of them want to enter the medical field and hopefully become nurses. From the day they start college, what are the steps that they should take to make sure they're on the right path to become nurses?
I would recommend first doing some volunteer work, just so you know that nursing is the right route for you, because I know a lot of people, they kind of have an idea that they do want to go into nursing, but they don't necessarily never had the volunteer experience, so they kind of jump into it. And I think it's very important for you to get some experience and see if this is the right field for you.
Yeah, while I was at community college doing my prereqs, like all the classes you need to take before you apply for the nursing program, I ended up doing a really short program to get my CNA license, which is a certificate where you get to help nurses either in a hospital or at nursing homes. So during that time, I really got the chance to work directly with patients as well as work under nurses and see how they work. So it really gave me, like, I guess, a taste of how the nursing world would be. So if you're kind of like undecided, or you just want to try it first, you can try volunteering or getting your CNA certificate and working at a facility.
I agree that you should definitely volunteer, or at least work as a CNA or an EMT or something like that first, because a lot of people don't know what they're getting themselves into. But it is a very great experience to be able to be in a medical field and, you know, really impact someone's life. On top of that, you should, or after you figured out you wanted to do nursing or some kind of medical field, you should really look into medical fields that you want to apply to, because a lot of schools have different requirements, either volunteer experience, a TEAS test, a entrance exam or something like that. So it's important to try to make a list of all the schools that you do want to attend to, and even if it's out of state, I would even consider that as well.
Just to elaborate on what Alan and Leona are saying, definitely do your research and do your homework, because that actually took me a while too. Like I kind of didn't know which route to go to. Like I was planning to go to like a 4-year and then maybe do nursing after that. But then I figured, you know, there's like a way to go into community college, because me and Leona actually, we went to the same nursing program. She graduated a year before me and I'm the year after her. But yeah, community colleges have it. They have great nursing programs, and along with 4 years as well. And you could go the private route as well, like what Ken did.
Yeah, like everybody else, like volunteer is really great. 2 hospitals have a good volunteer program for you guys to check out right now. The county, LACUSC has a very great volunteer program. Kaiser Sunset has a very good volunteer program. And these programs is really great is because if you're interested in a certain part of nursing, because nursing has so many different avenues. Remember, when you get into nursing, it's not just the medical part. There's management part, there's leadership, there's public health. There's so many things that you want to do, and then that's what's so great about nursing. And then on top of education, there's 3 levels: an associate, bachelor, and master's. No matter what 3 degree you have, you're all treated the same because you're under the 1 license. So certain hospital focus on certain needs, because some hospital wants nursing to have a bachelor or higher because they want to be magnet because they have a certain status. And some hospital don't mind, like the county will have an associate degree, but we're all treated the same way.
Cool, thank you. So, excellent responses. So what we, as high school seniors, they just got acceptances and letters back from colleges, and they might not have gotten to the colleges that they wanted to get into. In your opinion, does it matter, especially in your field, which school you get into? Does the name of the school and the prestige of the school matter in the field?
I don't think so. Because like what Ken was saying, we all, like once we get jobs, they don't really look at the school you're from. As long as you have your RN license and you're willing to work, or you have like past experience. I feel like the majority of the time when I was applying for different jobs, they weren't really looking for what school I was at. Mainly they were focused on if I have an active license, if I'm able to work. I actually got my associates in nursing first, and that's how I got it through community college. And then I started working, and while working, I was finishing up my bachelor's degree. So a lot of hospitals will hire you if you have your associate's degree from a community college. And for my bachelor's, I just want to add that I ended up going a private route. I went to Azusa Pacific University, and I thought the program there was really, really good.
So piggybacking off of what Leona said, if you are worried about whether or not you want an associate's degree or a bachelor's degree, there are programs like, for example, at Glendale Community College, where you can get your bachelor's concurrently, like what I'm doing at Azusa Pacific. So you take courses at your community college, and you're also saving money. And then in the summer, you'll take additional classes, like bachelor classes that are more focused on theory at the same time. So after you finish your associate's degree, you can work as an RN and then finish your bachelor's degree while you're working. So that's also another route that you can take.
And then to piggyback on what Sandy's saying, if you start working with an associate's degree, most hospitals will actually pay for your schooling to continue onto your bachelor's degree, which is also like a nice thing.
So hospitals don't really look at what schools, from what my own experience, they don't really look at the schools you went to, as long as what Leona said, you have an active RN license. They make sure that the school is governed by the nursing board. They're accredited. Just make sure that's a really important thing, because there's some like shady schools out there. Just be careful with those. But for the most part, all schools in the U.S. are, the nursing schools at least, are accredited by the nursing board. So no hospital.
Yeah, picking back on Alan, like they mentioned, they don't really look at what school you go to. It really comes down to what specialty you want to work at, and each hospital has their own specialty, and they have this thing called new grad program, and they train you because they see you as all the same level. So you got to be humble. You say that you're from UCLA, from Stanford, Harvard nursing school, and you go in there, you're all the same because you have no experience. So that's a great thing about being a new nurse, because you're all on the same level.
I'm glad you brought up UCLA, because UCLA has one of the historically lowest acceptance rates this year. And I was trying to tell these kids that a lot of times after you get your bachelor's degree, after you get into your career, no one cares about which school you went to. It just matters if you can do your job, if you had experience. So thank you for enlightening me on that. This next question, I was supposed to read the names for the kids, but this next question is from Alicia. She says, how do you guys handle the stress of your jobs?
For me, I'll go first, because I used to be a trauma nurse. I used to be a ER nurse, so I've seen a lot. So a lot of things. Best way is dealing with a coping mechanism, as in being a nurse, you're gonna have develop storing some of these emotions aside, because for me, you gotta do your job, because someone, let's say, passed away right there in front of you, you gotta continue on. What makes nursing so great is that you can talk to your fellow nursing. You develop a great bond with your colleagues. So you do a lot of activities together, and also have other things that you could do to cope with it. For me, I love exercising, I love reading. It's gonna attack you emotionally, but you gotta learn ways to let it out. It's not an easy job, I could say that.
Yeah, I completely agree with Ken. Like nursing, if you're working in a hospital, it's definitely not the easiest job, because most of the time, patients who do come to hospitals are at that point where they're really, really sick already. But I'm fortunate enough where I work in a department where in labor and delivery, most of my patients are healthy and most of them are there just to like deliver their babies. But there are moments where it can get really, really stressful for both the patient and the family members. So for kind of putting your feelings aside for a moment, just to make sure you're there for your patients. When you get home, sometimes it does get stressful. But definitely like try taking care of yourself. I think self-care is so important, and not bringing back work with you and thinking about what you could have done differently. Get a lot of sleep, because we both work night shift and our sleeping schedules are so off.
So nursing is a very team-based or team-oriented profession. So you'll be getting along with a lot of your coworkers. On top of that, you'll be meeting, like Ken, the case managers. You'll be meeting possibly nursing students. You'll be meeting a lot of different people, doctors, and then a lot of them are really cool to talk to, because you get to really understand, the medical view of patients and things like that. So if you like, interacting with others, especially patients, because that's why you're in the field, then it'll be really great for you, and it's really helps when you're able to talk to your coworkers about everything.
So just piggybacking off of what Leona said, self-care is really important. I didn't mention this, but I just barely reached my first year, my 1 year mark in nursing. And I'm actually in a new grad program. I just completed that. And like what they all said, throughout, your career, you're gonna be bonding with your coworkers, and a lot of the times you're gonna meet coworkers that have been there for like X amount of years, and everybody has different experiences. But everybody I've talked to so far, when I went on my own after having someone to guide me for 3 months, they told me that like you'll get better at it. Usually the first year is the roughest, and then usually once you reach your first year, you're gonna be able to navigate yourself, or at least kind of get the hang of the job, and kind of feel like you know what you're doing a little more than when you first started off. So it's normal for you to feel lost at first. For me, for self-care, I usually when I first started working, the first 3 months was, actually no, maybe the first 3 months alone. So basically, after having a preceptor for 3 months, and then my first 3 months alone after that were my roughest, because my time management was just off, and like I just have to learn a lot of things, figure out a lot of things on my own. And I like to exercise a lot, and like I read also, and I also, this is not a good thing to do, but I binge watch shows. But it's like whatever I feel like doing that day, I'll do it. But definitely like take care of yourself first, because if you're not there 100%, you can't take care of the patients either, and the patients need you. And every day will be different when you're on the unit or when you're going to shift. Like some patients will be really nice, some patients will be really mean, but it's just how it is. But the way I think about it is just, I like to give them the benefit of the doubt, and it's because they're sick, they're not exactly at the highest moment of their life, so they're vulnerable, and you kind of have to take that into consideration.
Okay, so I have 3 more questions. We're ended at about 12:50ish. This one's from Janelle. She's thinking about the nursing profession. Did you have any doubts when you were either becoming a nurse or when you entered in the field? So doubts about your profession, doubts about your abilities, and how did you overcome those doubts?
So I can start. For me, I feel like there were times when my stress would feel like it would overcome my goals, but at the same time, I think when you do start to feel like you're getting off track, or like you have to kind of think about the real reasons why you're here and the real reasons why you're investing so much time and your energy into a career that ultimately you're gonna love. So I think in terms of, in every career that you enter, sometimes you might have doubts, sometimes you might not, but once you actually take a step back and you realize the reason why you're working so hard, then those kind of negative self-talk or the reasons why you don't want to do something is, you can overlook that once you think about your ultimate goal.
Yeah.
Sorry.
Go ahead, Melanie. Go ahead.
So for stress, definitely this was my most stressful year, because I was learning how to do everything and trying to figure out my routine. I guess I reflect a lot. I think that's a really maybe good tool you could use to help out with stress. Like figure out, like, let's say you messed up on something. I mean, yeah, like being new, you'll beat yourself up about it. But what I learned to do is just reflect back on that, like kind of take that as like a lesson, learn your mistake, and then just kind of just do better. And for the new grad program, they made us, I remember the first 3 months when we had someone, when we were shadowing someone, we had someone guiding us, basically, teaching us the ways of the unit. They made us come up with weekly goals, like what kind of goals we set for ourselves every week, and if we reached it or not, and then we have that person sign off on it and evaluate us. So that's also one way.
I think for me I think everybody could say this. I think everybody have their doubts when they're in nursing school. I feel like that's when it starts, because you're gonna go through tests. Taking a lot of tests is very, very tough because you do a lot of studying. But once you got your past the board called your RN license, I feel like after that you could do anything. That's how I see it, because this is what you work so hard for, and then whatever job you're doing, you just gotta put in the effort. And sometimes you don't want to think too far ahead. You want to think one day at a time. Like I think about on everybody, the best care is your self-care, as in you gotta take care of yourself before you can take care of someone else. So yeah.
Just to quickly add on to everyone's comments, I think for all you seniors, it's going to be really, for me, it was really discouraging in the beginning, especially my first year in college. I wasn't able to get all my prerequisite classes, like your core science, your anatomy classes, your physiology classes, your microbiology classes. Those are always the classes that I wasn't able to get into because it was so impacted. So I noticed a lot of people that were trying to get into the classes, they felt really discouraged, thinking, how am I going to get into a nursing program if I can't even get into these classes? So just keep trying to add those classes, because there are going to be moments when you're in college where you're not going to be able to get all the classes you want for the semester. So just kind of spread it out. It might take some time, especially if you're going through the community college route. but you'll get there.
And for me, I think I'm different than everyone else. I am a second degree major, so I do have 2 degrees, a bio degree and a bachelor's in nursing. So for me, my bachelor's in nursing was very accelerated. Once I got my bio degree, I finished my second bachelor's in 2 years. So from there, everything was very condensed into 2 years. Preceptorships, clinicals, tests, homework, ATI, all this stuff. So if you do the more traditional route, like straight out of high school to a 4-year degree or a 2-year associates, it'll be a lot less stressful, and then you'll be able to really see if you really like doing nursing.
All right, so last 2 questions. This one is from, I think, Andres. He says, what has been the most rewarding part of your jobs?
For me, the most rewarding part about my job is, since I work in labor and delivery, I get to see like a lot of births and a lot of moments where the families are super happy because they have a newborn baby. Just seeing the joy in everyone's face and seeing like what a difference you can make. I actually had a patient come in the other day saying that I delivered her first baby 2 years ago, and I don't remember her, but there's little moments like that that makes you feel like what you're doing is really worth it.
For me, I think when I work a shift, I go home and then I come back either the next day or the next 2 days. I'm able to see really a difference I made in that patient's life, whether they're improving mentally, emotionally, or their health is improving. I was really able to see that I really made a difference, and then they're able to show their gratitude to me that, you know, I did make a difference in them and their family's lives. So it's great being able to come back the next day and see, you know, your work of art doing a lot of magic, and it's very rewarding.
For me, I think being a nurse in general is just a very gratifying, to be able to say that you're a nurse and to be able to help others is just a very gratifying feeling. Like even a simple thank you or being able to alleviate someone's stress or anxiety being in the hospital, that's just one of the many greatest feelings that you can get just from being able to turn someone's day around, because they're already in such a high stressful situation. They don't really know what's going to happen to them, especially when they're in the emergency department, for example. You know, just being able to alleviate their stress and their anxieties is just, it's one of the many ways that you can help as a nurse. Of course, taking care of the patients physically, but also emotionally.
So last question of the day, and I appreciate all of your time. This is from Octavio. What advice would you give a future nurse? What have you learned over the years that you would like to impart on someone that wants to get into the field?
For me, I feel like it's not how you start, it's how you finish. Because you can tell by everybody's story, how did we end up becoming nursing? Our beginning is funky because we all have different paths. But once you hit that goal of becoming a nurse, take it day by day, because what you get into, let's say for example, like me, I became a ER nurse. I thought I was going to be an ER nurse for 20 years of my life, but there's so many different avenues. So that's what I like about nursing, is that once you establish your specialty, keep thinking on to the future too, because there's other stuff you might want to do. You want to do ICU, you want to do public health, you want to be a school nurse. Or you want to get into leadership, or you want to get into the business side of things. And you could be an entrepreneur too in nursing, because you probably see on social media getting sponsored and things like that. So there's so many different avenues of being a nurse.
I would definitely, I feel like the advice I felt like I should have done when I first started working was definitely take it day by day. I usually always tend to overthink and kind of think into the future too much, like what if this happened, what if that happens. But from my experience, from talking to my coworkers and stuff, they could always tell when I'm frazzled. They're just take it day by day, what needs to be done right now, what needs to be done first, and then tackle the rest of the things later. That's probably I think one of the best advices I've gotten from and my fellow coworkers.
I think for me, the quote that really got me through college was short-term sacrifices for long-term gains. Because I kept telling myself I'm not going to be in college forever. I just need to get through this few like short years of my life, and then it'll really benefit my future. So short-term sacrifices for long-term gains.
To add on what Ken said, nursing is a very diverse field. You're never stuck in one place. If like what Ken is, he became an ER nurse first and then he became a case manager. I've had a nurse in my hospital start off as a floor nurse and became an IT nurse. So if you're into computers, IT, and nursing, then you have the best of both worlds. You can go into public health, again, be a school nurse, you could be a manager, many different fields. So you're never stuck in one place.
All right, we appreciate your time here. Thank you for joining our class today. I know your schedule's been busy, and I know if you haven't been getting it enough, we appreciate all the hard work you've been doing to fighting and ensuring the public safety of our society, actually. So I have a few more things to talk to the kids, but you're welcome to leave, but we appreciate you for joining us. Thank you for everything.
Thank you so
For having
much.
us.
Thank you.
Good luck,
Thank you.
everyone.
Good luck, everyone.
Thank you.
You got this. Oh, stop.
So you just exit the room. Okay, so everyone else, I hope you enjoy that. On Tuesday, we're gonna go over, there's a assignment. Let me share my screen with you guys. We just have about a few minutes before we move on, before we end our session. Okay, so hopefully you enjoyed that. I think they did a great job. What you need to do is do the someone's right now. Do the post-interview one. So what you guys learned from listening to them talk, and then afterwards, so we are meeting on Monday. There is this digital learning number 6. So there's 3 videos you have to look at, and it's going to tell you how to handle your financial aid package. So live viewers getting that, so it's going to teach you what you need to know. On that day, we're going to talk about. Huh?
I said at 8:30, dude.
Oh no. Sorry, man.
It's okay. All right. So on that one, we're going to talk about that. I'm having Hennessy prepare a lesson for us too. So hopefully we're ready by then. Next Thursday, I'm inviting some people who work in the tech companies. I have a friend that works in Facebook. One person works in Yelp. Another person works at Snapchat. So they're gonna come in and kind of talk about what you need to work in that field. And it's not just knowing computers, because in those companies, they have people that do HR, that do marketing, that do finance, that do just different fields. So just because you work at a tech company doesn't mean you only need to know tech. There's different levels of that. But with that said, thank you for showing up today. Hope you have a wonderful weekend indoors, I guess. And I'll see you on Monday. See you, everyone.
Bye.
That was
Bye.
that was pretty funny. I'm not gonna lie.